Representative Alan Peake is one step closer to making medical marijuana legal in Georgia. The House has passed his bill, but the Senate may pose obstacles. The Black Caucus is asserting its muscle on the medical marijuana bill and the massive transportation funding proposal. We'll talk about what they want. Plus, live report with the latest news from the Capitol. Lawmakers starts right now. Good evening and welcome to Lawmakers. I'm Bill Nigut. We're back from a brief snow break, and we're now at day 23 of the legislative session. There's been a major accomplishment. The budget has officially launched out of the House and is headed over to the Senate. Pat St. Clair has details on that and more in our Capitol Report. Hi, Pat.
Hi, Bill. Thank you. We begin tonight with the state budget. The House took up HB 76, the bill to authorize state spending for the next fiscal year, which begins on July 1st.
This $21.7 billion budget, however, will educate, protect, and keep healthier about 821,000 more people with fewer dollars and fewer government services and employees doing it at even a lower cost per capita than what we did in 2009.
The funding bill was explained line by co-author Terry England. With questions and answers, the entire presentation took more than 2 hours before the House took up the vote.
Shall this bill now pass? All those in favor of the passage of House Bill 76 will vote aye.
The bill passed on a vote of 171 to 2, and it was immediately transmitted to the Senate for consideration. We'll have more discussion on the budget and what it means later tonight in Lawmakers. Yesterday, with the threat of winter weather approaching and the legislature adjourning early, the House made quick work of passing HB 1. That's Representative Alan Peake's medical marijuana bill. The bill passed 157 to 2. Peake received a standing ovation and kudos from House Speaker David Ralston.
I don't know that I've ever seen a finer piece of legislating than Representative Peake has done over 2 years on this very important measure, a measure that is a real solution to a real problem that exists now. And I want to personally thank him and tell him that I am pleased to support his efforts.
All of this happened after rumors earlier this week that the bill might be dead.
I'd heard a lot of those rumors too, that it was dead. You know, it's not. But we took a good couple of weeks, and I give credit to Chairman Rich Golick of the Judiciary Non-Civil Committee, who said, let's make sure we perfect the bill. Let's make sure we get it right. Let's make sure we address the law enforcement concerns, which we did by putting a maximum amount of possession of 20 ounces, so that anything above that is a felony. And so we've hopefully addressed the concerns that law enforcement had, that all of a sudden there was going to be a trafficking of a large amount of cannabis oil into our state. We also made sure that we kept the patient-doctor relationship at the core of the decision. An individual who has a qualifying condition must obtain a registration card from the Department of Public Health in order to have immunity for possession. But they can only obtain this registration card upon a recommendation from a physician who is treating them for the qualifying condition. And so we believe that's a key component, that we keep that doctor-patient relationship at the core of the decision, and I think that's what helped it gain overwhelming support yesterday as well also.
Okay, now I know there was also an amendment that dealt with families that might have to go to a hospital and be treated.
That's correct.
Is that still a part of the bill?
It is. We wanted to make sure we didn't have a situation where a family or a citizen went to a hospital, and because they had on their possession cannabis oil or legally, and had been using cannabis oil legally, would be potentially turned away because the hospital would say, no, it's still a federally illegal drug, therefore we're not going to have anything to do with it. So we provided some protection for hospitals and physicians, as well as, and got input from the legal community of what made sense to protect patients, to protect hospitals, to protect physicians from potentially running into that scenario in the future.
Okay. And now the conditions, is it still 8 conditions?
We had 8 conditions. We got a lot of feedback from the Black Caucus in our chamber that we ought to include sickle cell disease. We have a large African American population in our state. We have almost 10,000 people who suffer from sickle cell disease in Georgia alone. And there's some real indication that cannabis oil can have a positive impact on the pain that these citizens suffer because of this disease. So it made sense, and I was glad to get the input from the Black Legislative Caucus, and so we made the decision to add sickle cell disease as a 9th qualifying condition in the bill.
With the approval in the House, the bill is now halfway through the legislative process. A little later in the show, we'll hear more from Representative Peake about the bill's prospects in the Senate. Bill, back to you in the studio.
Thanks. We'll see you later in the show, Pat. We're going to start tonight with more detail on the budget, which passed today. Of course, it's the only piece of legislation the General Assembly is actually required to pass each year, and it did pass overwhelmingly this afternoon. It's on its way to the Senate. Joining me to talk over some of the finer points, James Salzer. He's been on the state capitol beat for more than 20 years, past 13 for the AJC. He's part of the AJC's investigative team, and he specializes in state ethics, budget, and tax issues. He is the ultimate pro on understanding the budget. Also from the Atlanta Journal-Constitution tonight, writer Kristina Torres, who covers state government politics and the legislature. She is covering the Senate. And Liz Flowers, executive director of the Georgia Senate Democratic Caucus and a media and government relations consultant. Welcome to all of you. James, let me go to you right away. Sure. Let's talk about some of the items in the budget that people have taken a lot of interest in. And no issue, surprisingly, well, maybe not surprisingly, but a relatively small item, which is getting health care or keeping health care for workers like school bus drivers, cafeteria workers. How have they resolved that?
Well, they haven't resolved it yet because it's not over with, as you know. But what the House did was the governor wanted to essentially eliminate the part-time employees from the state health benefits plan. Part of the reason is because those school employees, according to the governor, the part of the plan that those school employees were on was losing money.
Right.
So what the House did, the House was hearing daily from when the
governor said he wanted to eliminate those benefits, people were calling like crazy. You got calls, I got calls, right?
Yeah.
So what have they done?
So what they did was they said, okay, we support keeping these employees on the state health benefits plan. That's the good news for them. The bad news for school districts is the amount the school districts who have to pay for non-certified employees would go up $103 million.
Yeah, they're kicking it back to the school districts themselves, right, Liz?
Yes, that's right. And, education and educators have really been taking it hard the past few years. I mean, we've seen cutbacks in health care. Now they're kicking this back to local school systems. If you subtract the amount of money that they're now kicking back to local systems that the governor put in the budget, their systems are only going to see about $177 million worth of increases. And many districts are still operating on fewer than 180 days school time.
Kristina, how's this going to play in the Senate, do you imagine?
I think that's a good question. I mean, we've talked about Jack Hill, who's the appropriations chairman in the Senate. His father helped get those benefits in place in the first place. There's the issue of fairness. Governor Deal, when he brought it up, said, I think it's fair that if we treat other employees one way, we need to treat everyone the same. Terry England said the same thing as the budget was being passed out of the
House Appropriations Committee.
Jack's counterpart. So I think it's an issue. I mean, I think that's presented as a compromise, that they keep it, but it goes to the local districts to pay. I mean,
the argument on that is that those employees are school district employees and not state employees. The argument about no state part-time employees get insurance is mostly true, but the one group that does get of part-time employees that do get health insurance are state lawmakers.
So could we, So could we imagine that we're going to see lobbying against that provision from school districts, from Superintendents Association or whatever? What do we think on this? Are they going to push back when it goes over to the Senate?
I don't think it cuts into the increase essentially that the governor has proposed for school districts. They were supposed to get $280 million to pay for raises and furloughs if they didn't have 180 day school year to add school days. Well, now they're paying this $103 million. So whether I assume that when they saw the governor's budget, they weren't prepared for this. So that takes a lot of that money away. So I would assume they will.
Let's go on to another issue. There's, excuse me, there's something like $1 billion in bonded indebtedness embedded in this budget, you said before we went on the air.
The governor originally proposed $800 million, if I remember correctly, somewhere around $800 million of bonds, most of it for K-12 colleges, K-12 schools, colleges, technical schools. But the House kind of put the first card down on transportation by putting $100 million in for
transit.
For $100 million for transit.
Right.
But that's transit around the state. So it can mean bus services in Hahira as well as MARTA.
Right.
I'd also $100 million for fixing roads and bridges. Chairman England said that some bridges in the state are in terrible shape, and that needs to be fixed.
Right. So $1 billion in bonded indebtedness comes back down the road to cost the state an awful lot of money. It's not unusual for them to do this, though, is it, Kristina?
No, it's certainly not. I mean, it's all part of the negotiation as well, because now we're going to come back from the Senate side to see how much in that $200 million, especially since we're very worried about transportation this session, they're going to keep. I mean, it's part of the game. So, he proposed $800 million. They're coming back at $1 billion, and who knows, maybe we'll end up at $900 million.
Democrats okay with that, Liz?
I think we'll see. There are a number of issues in the budget that are priorities for us. I mean, one of the things that I think that the Senate Democrats are concerned about is that the priorities overall in the budget are wrong. While transportation is a priority, so is education. And we're seeing line items increased, for instance, the stadium. And parking, that's what, $23 million? And so where are the state's priorities?
Yeah. One last thing on the budget. We talked about there's a Medicaid bump that's not happening. The federal government was giving Medicaid doctors some additional pay to continue treating Medicaid patients, and they have now pulled that away. And the question was whether the state was going to make up that gap. They're not, are they, in the House plan?
Well, in the House plan, they're not. It's, again, this is not done yet, and there's plenty of negotiation going on. But they did put a relatively tiny amount of money in a $13 billion Medicaid budget in for OB/GYNs, I believe. But it's not nearly, I think $60 million is what they
And there are Medicaid doctors who are saying, and in your newspaper they talked about it this weekend, some of them, that they're not going to be able to continue treating Medicaid patients if they don't get more money.
I mean, it's an ongoing issue. It's, we can argue both sides, pro and con, and I know the Democrats have a very strong position on this, but it's going to be an ongoing issue, and it's not going to go away this year. I mean, we talked about, or there has been talk of a cigarette tax, for example.
Right.
It's been brought up in the transportation arena because it could bring in, what was it, around 600 million.
Yeah. If we can, let's move on to a couple of other issues that we want to address with our time. Liz, let me start with you on this. The Black Caucus has, this past week, stood strongly on two big issues for them. One of them is sickle cell anemia was taken out of the list of conditions that were going to be allowed for legal cannabis oil. The Black Caucus insisted it go back in, and they got it back in the House, right? But over on your side, Renee Unterman, Republican, who wants to strip out from the bill everything except seizure disorder for children. Is that going to be a big fight?
I think it is going to be a fight in general, and I think with regard specifically to sickle cell, but I know you're going to raise the next issue on this, which is minority business contracts. This large of a population should not be an afterthought. I mean, the fact that we're having to add back in a disease that impacts so many African Americans, so many Georgians in our state, in this day and age should not be a second thought. I think Senator Unterman is coming at it from a very different angle by limiting the number of illnesses that are covered. But, we've got to do a better job taking care of Georgia.
Do you expect to see a fight over on your side?
I do. Senator Unterman told me at the beginning of the session she had drafted a bill that very specifically said there could be this oil, but only for epilepsy, a seizure disorder affecting kids. She hasn't dropped it yet. It's not filed. But I do think that's very much a part of the discussion.
So there was another issue that the Black Caucus took on this week that Jim Galloway reported in the Constitution yesterday. The transportation bill, assuming it passes, and there's increasing question as to whether it will ever get through this year, it's a $1 billion proposal. Black Caucus points out that only 3% of the contracts for road construction go to minority businesses, and they find that shocking and scandalous. And if there's going to be a big package like that, they think the state needs to address that, right?
But there's a joke in the hallways, outside the chambers, which is this is the paving bill, because paving contractors will get the money from it. That too has been an ongoing issue at the Capitol in terms of what kind of businesses the state helps, do business in Georgia. I mean, it's been an issue for Senator Vincent Fort on the Democratic side. That's not going to go away. I can imagine the well speeches he's going to give on that when it comes to the Senate.
Well, and Calvin Smyre in the House has now said, and he's been a very highly respected member of the Black Caucus, a leader in the House, that he wishes this had been addressed earlier because he doesn't know how they're going to do anything about it legislatively at this point. And I think Republicans are saying, let's let the Department of Transportation take care of this down the road.
The history of this is that at least in the 90s, that was a very strong issue for Republicans. I mean, they fought very strongly in the legislature and in courts against any kind of set-asides
for minority businesses.
Right. So,
all right, we're going to watch that. We got to take a break. We got a lot to cover tonight. Still ahead on the lawmakers, the Senate is going to take particular interest in the question, paper or plastic. That and much more ahead when Lawmakers returns.
Wheat, the perfect obesogen. It makes you want to eat all the time.
Learn why our most common food is bad for your health.
We have full control over impulses, appetite, and our lives. You don't.
Make this revolutionary one-step health and weight loss plan work for you. Watch Wheat Belly Total Health with William Davis, MD.
This is not about being gluten-free.
Next on GPB.
I was always the type of kid to take things apart and try to put it back together. Our main goal in the field is to keep the transmitters on at all times. The transmitter goes off. That's when my ears go up. They're gonna call me. We're on call 24 hours a day. I've been here a while, and I've met some of the best people in the world. They wanted to do their best, and they wanted you to do your best. That's what we try to do here. We try to be the best. My name is Damon Maxwell, and I'm a field engineering manager with Georgia Public Broadcasting.
This is 88.5 FM, Atlanta's news source for your news and information.
Good morning. Let's start the conversation. What's on your mind, Atlanta? We want to hear from you.
The news and information you've been looking for is here on 88.5.
From Peachtree City to Piedmont Park, from Norcross to Decatur, GPB Atlanta is the source for stories from your community.
All news, all information, all day.
On this date in 1854, then-Governor Herschel Johnson signed a bill agreeing that he would determine the feasibility of draining, quote, a large tract of unimproved and at present worse than useless land. Things never really got going on that plan, which might have ruined the largest intact, unfragmented freshwater and blackwater wilderness swamp in North America. We know it as the Okefenokee. Welcome back to Lawmakers. Our panelists on our post-snowstorm edition are James Salzer from the Atlanta Journal-Constitution and his AJC colleague, Kristina Torres, and Liz Flowers, Executive Director of the Georgia Senate Democratic Caucus. So we're going to get back to them in just a minute with some more conversation. But before we do, we want to go back down to Pat St. Clair for a little bit more on her conversation with Representative Alan Peake. Pat?
Well, Bill, as you know, the medical marijuana bill is likely to end for a much tougher fight in the Senate than it had in the House. So we asked Representative Peake what he's hearing so far from lawmakers in the Senate.
Well, I'm hearing rumors that my colleagues in the other chamber are interested in only passing a bill for kids with seizure disorders, and I'm pleading with them that they would move forward with HB1 with the 9 qualifying conditions in it and pass the bill so that cancer patients and MS patients and those with Crohn's disease and ALS will be able to benefit potentially. As long as we've got at the core of the bill that the doctor is making the recommendation, why would we not allow other diagnoses that could potentially benefit from the possession of cannabis oil? And so that's going to be my plea to my colleagues in the Senate is we've got the safeguards in place to make sure it's not abused from a medical standpoint and from a law enforcement standpoint. Let's pass this bill. Let's get it moving through the Senate. Let's get it on the governor's desk so we can start bringing these medical refugees who've had to move to another state and bring them back home.
So I know you've talked with your colleagues in the Senate. What are they saying? Do you think you really have the support to get it through the Senate?
Well, I think my colleagues in the Senate have the same view that my colleagues in the House did. That once they understand what the bill does, that they'll have the same compassionate view as well. There are almost 500,000 people that could potentially benefit from access to cannabis oil by the passage of this bill. So why would we not, if the doctor and patient are making that decision, why would we not allow as many conditions as possible while also keeping it limited to make sure that we take a good first step?
So we have a number of families that have moved out of state in order to get the cannabis oil that we need. With the bill passing in the House, are they confident that they'll be able to come home?
There will still be obstacles, even if we pass this bill, for families to access cannabis oil. We have had a good discussion with a manufacturer that is in Colorado that makes a product that a lot of the families are using, and because it's so low in THC, it's considered hemp. They believe they will be in a position to be able to ship the product from Colorado to Georgia to our families here once HB1 is passed. And that's a big deal. There is still the risk that someone who wants a higher level of THC below our maximum of 5%, but a cancer patient who wants a 4% THC product would have to travel to another state, obtain the product legally there, but would be in violation of federal law as they did travel back to Georgia. Once they're back in Georgia, if they've followed all the protocols we have in place, they would have protection from prosecution and have immunity. But yes, there is and quite frankly, until we come up with an in-state model for growth, processing, and distribution of cannabis oil in Georgia, which we're hoping to do in 2016, that will remain an obstacle for many citizens in Georgia.
Have you spoken to the governor since the bill got through the House? What is he saying? What is his response?
We have. He was supportive of a limited number of diagnoses and had some concerns when we expanded it, I think, to 17 when we initially had the first committee hearing. I believe reducing it to the 9 conditions that we have now, I believe if this bill is passed by the Senate and ends up on the governor's desk, I believe he'll sign it.
Bill Peake says he is hopeful that he can get this bill on a fast track through the Senate and onto the governor's desk. Of course, he'll be with you on Lawmakers next week, so we will definitely expect to hear more about the bill's progress then.
Thanks, Pat. And of course, as we heard the panel say a few minutes ago, there is going to be some trouble on the Senate side, especially if Senator Unterman decides to push hard for having only one condition, seizure disorder in children, covered. Chicago, LA, San Francisco, all of those cities have banned the use of plastic bags in grocery stores and other retail outlets. Today, the Georgia Senate made it clear that this kind of decision shouldn't be left in the hands of locals.
We have 159 counties in the state of Georgia. We have 536 cities. And as you can imagine, if each of these individual localities had a individual regulation in regards to this particular issue, that we would have what could be coined as regulatory mayhem for our businesses.
But it would prohibit it, is it not true, local governments from enacting on their own by local decision in their local community, responding to their local constituents' reaction or bans to certain type of containers?
I would argue that local consumers would have an option to participate and spend their money in businesses in local areas if they saw that as an issue in these particular areas, whether or not to to go to that business and buy their products if they use certain containers. I would also argue that the state of Georgia is just as much interested in the safety and security and the environment of our great state as any local municipality or county.
Made-up issue.
That bill passed 32-19, and it now goes to the House for consideration. Environmentalists aren't happy about this. They're calling SB 139 the plastic bags everywhere bill, and shouldn't we all be using recyclable bags, for goodness sake? Liz Flowers, the governor tonight has a group of legislators with him in New Orleans. My guess is they are not at Tipitina's listening to the House band and celebrating. What are they down there for?
They are down to look at the Recovery School District that the governor is using as a model for his legislation. And I think it's a whirlwind trip, 24 hours or so to kind of cram everything in, and then they're back tomorrow.
And what do you imagine? How many Democrats from the Senate are on that trip? You don't have to have a number, but you have some, right?
Senator Elena Parent is on the trip, and I think there are two House Dems, Leader Stacey Abrams and the Minority Whip, Carolyn Hughley.
Is it your sense, Kristina, since you cover the Senate every day, that the governor is going to win some Democratic support for this measure? He probably needs some Democrats on board.
He does need Democrats on board. I mean, in theory, he has one on board, which is Freddie Powell Sims, who's a Democrat from South Georgia. She was supposed to go on the trip, but I understand she did not make it. But she has signed the constitutional amendment that's part of this plan. You need 38 votes in the Senate to pass it, and she's the 38th vote. But they've reached out to Ed Harbison, another Democrat from the Columbus area. They've reached out to Donzella James from the South Fulton area. I mean, they're definitely trying to make sure they had the margin they need in the Senate. I think they started it in the Senate because it's a little easier to do. Republicans have a supermajority there. House will be a tougher sell. They've got Stacey Abrams with them, Carolyn Hughley. That sale's already starting. The pitch is already there. But I think the House is where you're really going to see the negotiations start.
You know, just to circle back for a moment on an issue that we talked about in the first segment of the show, and that's going back to the Black Caucus speaking out about minority contractors in terms of this transportation bill. There's an issue where they really do need black support to get that bill passed. So that's one of the reasons it's essential for them to try to figure out some way to address this concern that the minority, the Black Caucus, has about getting contracts, yes?
Right, and more so probably than the school issues, because there's absolutely, it doesn't appear to be a consensus among the Republicans about what to do. There's so many that reject the idea of any kind of tax increase that, anytime in the Republican Party that you say the word tax, there's going to be a certain amount they're gonna be off the board on it. So you got to have it.
Let's have a couple of seconds, if we can, saved here for Josh McCoon. Senator McCoon, his religious liberty bill, he introduced it a week or so ago, had high expectations for it, goes to committee.
Well, I went to committee the next day. I mean,
right.
It was a really quick turnaround. I thought he could really get it out.
And he got it tabled because he wouldn't deal with an amendment that would assure this would not be used to target gays, lesbians, and other minorities, right? Where does that bill stand now? Is he getting it back?
It's still on the table. I mean, and it should be noted the amendment was put forward by the Majority Leader, Bill Salzer. Yes. I mean, so a certain statement was made
in
that.
Josh McCoon's own committee.
On his own bill, which he thought he'd get out within that 24-hour period, essentially. I mean, it's still on the table. I think there is very much a desire among the leadership to get that amendment on, and we can talk about whether it's a poison pill or not. They say absolutely it's not. They will support the bill, but they want to make clear that they're not trying to discriminate. My understanding is there are certain changes being proposed, one which would strictly look at the federal language, put it in the state bill. That does not answer the issue and the controversy among opponents that it would allow some businesses to cite religious reasons for doing something.
I'm going to give you one quick last word on this.
And to Kristina's point, I mean, that's the federal language uses the word person, and at the federal level, that language then includes corporations, and that is going to continue to be
some corporations.
Some corporations. It's going to continue to be a sticking point, particularly for Democrats.
And this is an issue we're going to watch on day 40 at 11 p.m. is my guess, right? Okay.
Absolutely.
All right. Listen. thank you all so much for being in tonight. Day 23 of the 2015 legislative session is now a wrap. We're going to be back Monday night for full coverage of Day 24 and all the latest news from under the Gold Dome. In the meantime, stay in touch with us on social media, or you can email us at lawmakers@gpb.org. Thanks for joining us tonight. Thanks again, panel. Have a great evening.
This is a GPB original production.